welcome back to my channel. Today we're going to be talking about 3 different types of stress-related hair loss. It's Mental Health Awareness Month, and I want to bring awareness to 3 different types of alopecia that you could potentially have and not even know it. Who to go to for professional diagnosis and treatment, and how to potentially reverse, but most of all, prevent yourself from getting it. And the first one that I want to talk about is Telogen Effluvium. What happens with this type of alopecia is caused by some type of traumatic event or shock to the body. Common time that a lot of women experience Telogen Effluvium is after childbirth. You can experience heavy shedding, you can experience your temples getting thinner. That is telogen effluvium. And what happens is your follicles prematurely go into the resting phase of the hair growth cycle. Okay, so that's what's happening. Hair shedding and hair breakage are 2 different things. If you start to notice your hair shedding, then you definitely want to seek out a medical professional. And I'll talk more about the type that you need to seek out if this is happening to you. The second type is Alopecia areata. It's an autoimmune disease. It's when your immune system attacks your hair follicles and you start to notice circle patches all throughout your head of hair missing. A lot of times you can recover from it and the hair does grow back. However, stress can be a trigger to a flare-up. So if you are experiencing patches of missing hair and you're just dismissing it as a stress spot, like a lot of people do, understand it is something serious and you need to seek a medical professional so you can get diagnosed and you can start to treat it. And the third type is Trichotillomania. It's a nervous disorder where you pull at the hair on your scalp. You could pull out your eyelashes. It's really just hair anywhere on your body. And it's a nervous disorder. I know quite a few people who have that and have joked about it. Clients that I've had, like just saying that if their hair would be out, it would be something that they would do. That's called trichotillomania. A lot of the things that we normalize are really ways that we're soothing to soothe stress. But it's not a behavior that should be normalized. It's something that needs to be addressed. Now, the type of medical professionals that you should seek out if you have any one of these 3, okay, or think you may have any one of these 3. The first one is a dermatologist, a physician who specializes in diagnosing and treating hair, skin, and nail disorders. The second type is a trichologist. Differs from a dermatologist in the sense that the only thing that they focus on is hair and scalp. If you wanted to go to a physician that kind of specializes in just that one issue, then a trichologist would be the one that you would want to go for. The third type of medical professional you should seek out specifically for trichotillomania, you would want to seek out a psychiatrist or a psychologist for diagnosis and an alternative treatment plan. Trichotillomania has a very significant psychological component to it. Another thing I want to add is it's important that you seek out a physician who is culturally sensitive to the needs of people who have Afro-textured hair, because our hair doesn't grow like other races of people. Okay, so now I'm going to share some things that you can do to prevent and potentially reverse each of those 3 types of stress-related alopecia. When you talk about preventing and potentially reversing different types of alopecia, it does require a specific strategy that's tailored to each condition. So here are some general approaches that you can take. So for telogen effluvium, you want to manage your stress effectively through relaxation techniques such as meditation, deep breathing exercises, yoga, or just practicing mindfulness so you know that it's time for you to balance out your stress. You want to ensure that you have a balanced diet, up your vitamin and mineral intake, specifically for your hair. So iron, zinc, vitamin D, and protein would be perfect. Don't go any crash diets. Crash diets that give you a rapid change in weight can trigger telogen effluvium. You want to practice good hair care habits, try to use the best shampoos, salon quality, avoid excessive heat, and definitely no chemical treatments. You want to get away from relaxers 100%. You also want to address any underlying health conditions or hormonal imbalances that can contribute to telogen effluvium. Now, alopecia areata. The first thing you want to do is make sure that you consult with a dermatologist for proper diagnosis and treatment options. They might include the corticosteroid injections. They also offer topical immunotherapy because it is an autoimmune disease, and systemic medications that will suppress the immune response. Consider lifestyle modifications that are going to also help you reduce your stress levels. Stress can actually exacerbate alopecia areata. It might also be beneficial for you to start exploring alternative therapies like acupuncture or aromatherapy, yoga, deep breathing, meditation, and a lot of people find these things helpful in managing symptoms. Now, trichotillomania. For this, you want to seek therapy or counseling to address any underlying emotional issues or psychological triggers that are contributing to the hair pulling behaviors. Develop alternative coping mechanisms so that you can manage your stress and anxiety, like journaling, exercising, or just finding a hobby that you can put your energy into. You may want to consider wearing gloves or keeping your hands occupied with fidget toys, and this can kind of help prevent hair pulling episodes. Get your friends and your family members or support group involved. Okay, let them know what's going on. This way they can encourage you and then also hold you accountable if they catch you pulling on your hair. You also want to maintain your overall health and well-being through regular exercise, getting good sleep, eating healthy. Okay, all of these things, it's going to take a holistic approach when it comes to stress-related alopecia. So I want to share this quick pro tip if you are a new mom, an expecting mom, just to give you heads up on should you experience telogen effluvium shedding after childbirth. I experienced it after my last son. I've always had pretty much a normal full density of hair, and when he was about 6 months old, my hair just started shedding like crazy. It shed so much that I was thinking about using Rogaine, but then I decided not to. And I just started looking at natural remedies. I came across this woman's blog who had blonde hair. Her hair was broken off and just, it looked horrible. And she had a side-by-side picture of her broken off bleached hair with this beautiful red tinted, now thick, lovely, her elasticity was on point. And yes, people with straight hair have elasticity too. The way you know someone with naturally straight hair has elasticity is through their ability to hold a curl or a wave. So I just loved that difference, that 1 year difference that I saw in the health of her hair. Come to find out, she was using henna. I started researching henna, and one of the benefits was that it tightens the hair follicle and helps to prevent shedding. And for my very first henna treatment, it put it in check. So if you're gonna have a baby, know someone who's having a baby, just had a baby, and you wanna prevent it, henna would be a great way to go. If you'd like for me to go more in depth about Ayurvedic powders and treatments for your hair, write henna in the comments, and I'll be sure to make a video where I go into detail about Ayurvedic products. That wraps it up. Thank you for watching, and I will see you in the next video. Peace.